Hello, I'm Dr. Alan Law, and I'm president of the American Association of Endodontists. You might be wondering what an endodontist is. An endodontist is someone who treats the diseases that start inside the tooth, and that includes pain and infection that can be coming from a tooth. So we do root canal procedures. An endodontist spends typically 2 or more years after dental school learning how to do root canal treatments and prevent and treat diseases that start inside the tooth. The endodontists also use specialized equipment like 3-dimensional x-rays called CBCTs and surgical microscopes that allow us to see the intricate anatomy inside teeth. And all of these can increase the effectiveness of treatment or increase the success of treatment, as well as minimize the number of treatments that are necessary to do root canal treatment. And we certainly have ways to get you comfortable and less anxious about the treatment. The American Association of Endodontists was concerned about what was happening during COVID with patients, and we did a survey and found that 1 in 5 patients were not brushing their teeth on a regular basis in the morning, 1 in 3 were eating more sugary snacks, and at least half the patients were not scheduling regular dental care. All this can lead to an increased risk of getting cavities and having the need for root canal treatment. So it's important to both improve dental hygiene habits, cut back on sugary sweets, but also get into your dentist. If you do have severe pain to hot and cold, or lingering pain to hot and cold, or pain to biting on your tooth, or if you have swelling around a tooth or draining infection, all these can indicate that you might need a root canal treatment. You also might be told by your general dentist when they look at your x-rays that you have some infection in the bone around the tooth, and that could be another reason for root canal treatment. When you're told you need a root canal treatment, it's appropriate to ask, should I see an endodontist, someone who specializes in doing root canal treatments? Also, we should note during COVID that some people had a fear of going to the dentist because they thought they might be getting COVID in the dental office. We have taken several precautions, dentists always have, to prevent infections in the dental office, and this has only been heightened by recommendations from the CDC, the American Dental Association, and boards of dentistry. So it is safe to go into a dental office. It's certainly safe to get root canal treatment, and the CDC has no documented cases of COVID transmission during a dental procedure. If you'd like to know more information about the safety of root canal treatment or precautions that are being taken during COVID, you can go to AAE.org, that's the American Association of Endodontists, or you can go to findmyendodontist.com to find an endodontist to provide safe and effective and comfortable root canal treatment.